And then kind of tuck that end under my other tube. Blah. It really hurts to start with, but then everything just kind of calms down. Okay, when I had my first tube surgery done, and it was so apocalyptical bad, one of the nurses told us about pain patches. She asked if I had any pain patches. I'd never heard of it before. So they brought out Lidocaine pain packages, and they were like 8%, I think. So, okay, but in the hospital, so you got the 8% ones. You can wear one for 12 hours, but then you have to go without for another 12 hours, which doesn't really work for me when things are really, really bad. So we found these over the counter, so they're 4%, they're half strength, but and you can wear them for 8 hours, but I can wear them back to back to back. You can't wear more than one at a time, but I did learn that you can cut them, so you can kind of like puzzle things together. So you take the top off, and it comes out, they're almost like migraine gel patches. But they don't stay cold for very long. So you pull it apart, and it just pulls the backing apart. And for this new tube, I cut this one down the middle. And then I cut one more lengthwise, because I finally figured out what fits. So everything is still super swollen, so it's been a week and a couple days since I had the surgery. And I know the first surgery, like I literally, it was awful for at least 3 months, 4 months. It was really, really bad. So I feel like I should already have like a learning curve. Like I already learned on that one and I don't need it anymore. And so I feel like this one should heal faster. That has not been the case so far, but we'll see how it goes. Okay, so I have a massive amount of pain in my lower left because I've got so much large intestine involvement. So I kind of dual purpose these. Okay, so you have to get it, and it's like this gel stuff. Like it's not like sticky, but it's sticky. Okay, so this one goes down here as close as I can humanly get it to my clips without touching them. And then you just smoosh it down. And it will stay really well for 8 hours-ish. And it's really cold when it goes on, which is really kind of hard because my nerves are messed up down there. So this part, it really is like the bonus round of awful because it hurts really bad before it starts helping. Okay, so this one goes between my two tubes. It really doesn't feel good when you put it on to start with. The worst part of, and this tube is okay, no problem, especially since we got all the extra tubing out. This one, like my two clips are okay. Top and bottom ones are awful. Top one is the worst, so I try to make sure I'm as close to everything as I possibly can be. It really does make a difference. And then this one goes this way. So I have a little overlap on this side, but it works pretty good. Okay, and all I did to clean everything off this morning is just I take a shower and I let warm water run over it for as long as I can handle it, or I get too tired and I can't stand up anymore because showers are the devil. Okay, so I get these these are the kind of gauze that I use. I got them with the first tube, never used them, thought they were horrible, but I think for whatever reason, I thought they were like the stringy gauze, and I don't want that anywhere close to my tube. So these are actually how they come in. So there's 2 per package, and they're specifically made for like, you know, around tubes or drainage lines, anything like that, and they've really been amazing. So after I put pain patches on, I just scooch it up. And then kind of tuck that end under my other tube. Blah. It really hurts to start with, but then everything just kind of calms down. I had a huge amount of drainage to start with, which kind of freaked me out because I never had that with my other tube. But what was also weird about this tube is it started venting like 4 days after surgery. But it wasn't venting when I had like the cap off, like it was venting like beside the tube. It's just really weird. This one's been totally different than the other one, which obviously mentally made it a heck of a lot harder for me because you think you know like what you're getting into, and so it's just been rough. But I had a heck of a lot of drainage with it, and I mean I was soaking through like 5 or 6 of these in a day, and I never had that with the other tube. But now that like I'm really able to shower with it and like rinse it off so thoroughly, it seems a lot better on the drainage, which is super great. So we'll keep on keeping on, and then so this one will be looked at on Tuesday, so I've got a few more days to go with it before we look at everything and see if we can take clips out and all that good stuff. So I hope this helps anybody else, like, and these pain patches are good for anything. I mean, I'm so thankful that one nurse told us about them. I don't know what I would have done otherwise. Come out of my skin about 14 times. So it really, really, really works. And you can get these just about anywhere, Walmart, CVS, Walgreens. I think we've bought them at all of those places. But now I buy them in bulk through Amazon, and you can buy 12 boxes at a time. And I think they're like $115 or $120. I'll put the link to them in the description box below so you guys can link to it. So anyways, it has certainly helped me, and I hope it can help anybody else too. So I'll see you later. Bye.